Hi, my name is Mahawa Kuruma. My topic is on security issues with medical devices. I'll be focusing on four main medical devices. Number one is telehealth. Telehealth is a virtual care system. So a patient can just use their phone or computer to call a doctor. A doctor can virtually monitor their vital signs, their weight, their blood pressure, provide diagnosis, and write up prescription, all through a virtual programming. This is especially beneficial for senior patients because they are unable to go in frequently for visits. They can visit a doctor virtually, and also for patients in the rural area, there are not a lot of physicians in those areas, so they can use virtual communications to transfer such information. The second one would be robotic surgery. Robotic surgery is mainly used for operating on brains, sometimes liver, or to put in hip replacements. Robotic surgery is very necessary in the medical field because it can operate on the tiniest arteries, veins, hard to reach locations, hard to reach section of the brain, and also it has more accuracy than a manual physician operation. But a physical presence of a physician is still needed in the operating room for now for it to guide the robot. The third medical device is implantable devices. The main focus will be on implantable pacemakers. The step-by-step process of this implantable pacemaker is that a physician plants a pacemaker and a sensor at the home of the patient. That sensor can monitor the patient's movement, the patient's heart rate, and give that feedback back to the physician. The physician can then view and interpret this information and use that information to see if the patient's heart rate needs to be increased, decreased, or come in for checkup. This can be also done with insulin pump to increase glucose level or decrease glucose level. These are also very vulnerable to attack because it's used based on a third-party vendor. So a software programmer sends this information to the doctor. The doctor then sends the information back to the software programmer, who then sends it to the patient. So it can be easily attacked through the process. The last and final medical devices that I will be discussing in the paper is MRI, CT scans, and X-rays. These are really good for making diagnoses. For example, if a patient comes in and say, "Oh, I hit my head today," a, a doctor can then see, oh, if it's a common concussion or serious brain injury by taking an MRI scan and give the right diagnosis. Then the doctor can continue with the right course of treatment. Before the use of MRI, a head injury can just go unnoticed and can later cause on serious brain problems, lead to paralysis or unconsciousness, even death. All these medical devices are necessary in healthcare but they pose major security threats. So these are the security issues that my paper is going to be discussed.